Heavy menstrual bleeding or abnormal uterine bleeding are one of the most common reasons a woman presents to a gynecologist's office.
I started noticing a difference in my menses about 3 years ago. I have never experienced PMS prior to that. I have always been very healthy, but 3 years ago I started having pain, and along with that, a little bit of heavier bleeding.
So, periods obviously are a normal part of reproductive life. However, they become a problem when you have pain or the amount or frequency are more than what should be normally expected.
And then it progressively got worse, and I just thought that it was part of aging.
Women don't often seek help because they've been told, perhaps by family or other providers, that this is normal to have heavy menstrual bleeding. It's part of being a woman.
And it was about a year later that I was referred to my gynecologist.
Missing work, missing school, not being able to do what you normally want to do for fun or pleasure are all reasons that one should try to seek attention.
So it affected my quality of life. It affected my work. It affected my social life. I became quite depressed.
The economics of it is significant. It can be very costly in terms of using sanitary pads quite frequently when this problem arises.
I have tumors that are benign, and they're actually quite big. 4 of the biggest ones were about, at that time, the size of a grapefruit each, and then there were multiple others.
A fibroid is a non-cancerous growth of the uterine muscle, which is quite commonly found amongst women of reproductive age. There are medical options that are non-hormonal. There are hormonal options, there's surgical options, but there's also now targeted treatments acting directly on the fibroid, which can result in decreased heavy menstrual bleeding, but also shrinkage of the fibroids.
There were 2 options that I felt were quite invasive, and I didn't want to go that route. They would involve surgery, and I felt quite concerned that I would lose my womanhood, and that's something that I did not want to explore.
So we have always had some treatment for uterine fibroids, but today, more than ever before, we've got newer treatment options. And the newer treatment options look at selectively blocking progesterone receptors to the fibroids. And for the first time, we have a medication that provides that targeted therapy.
I really liked that the dialogue was open for the first time. And that was really the missing link for me.
So bottom line with respect to uterine fibroids and the symptoms they cause is that there are treatment options and that they need to decide what's right for them, the patient, and the physician or the provider will guide them with these options.
I didn't really know that there was such a simple solution to something that had pretty much destroyed my life. So I'm back on track. I work. I'm back to the gym. I'm jogging again. I'm more involved with my husband and my friends. So it has really turned things around for me. It has made a huge difference.
For more information about fibroids, symptoms, solutions, and what's right for you, visit healthandfamily.ca/fibroids or sogc.org.